Hi everybody, it's Margarita again. I want to start with saying thank you for coming to visit. This is going to be part 2. My anti-cancer journey. And I wanted to forget actually the last time to tell you about another member of my cancer support team was the surgeon. In fact, before getting into the whole cancer, the hold of the whole cancer medical community, I was getting my testing done, gastro, endoscopies, which entailed looking in their stomach with a scope, but also taking a biopsy, which is very, very dangerous. I'll let you know that any kind of biopsy is incredibly, incredibly dangerous, whether it's a benign or a malignant tumor. You're looking at a whole cluster of cells inside of a sac. So if you are actually poking into that with a tool, you are going to be creating some more damage to the tumor or the cyst, the growth, releasing some of those damaged cells. So keep in mind what you're getting yourself into. I was blind and I didn't know, had an actual gastroendoscopy in the initial stages, and then the pathologist finding absolutely nothing. Oh, I think it's an ulcer. It looks like a little bit of debris. It looks like a little bit of burning. My own GP just completely out of touch with reality. She also tried to downplay it and throw some sunshine up my butt. Oh, it was all good. It's like a little burn from an ulcer. The pathologist couldn't find anything. If you feel you should get a second opinion, I think you can get one. Okay, fast track me to another biopsy, another gastroendoscopy where they're doing another biopsy at a different clinic to actually get the result that there was a tumor. But mind you, the first gastroenterologist told me right away in the office, I'm sitting in there after I've woken up from sedation, she's telling me, you've got cancer. You need to start chemotherapy right now. And the pathologist and my GP, no, she had no right to tell you any of that. She can't diagnose you. She can't be using words like that. That person actually had the right idea, at least to tell me that this is what it is, and I don't have to get another procedure done, which would have been extremely, hopefully wasn't that harmful, but it is, and I had 2 of them done back to back because of this mistake. Then the third time, I forgot to mention the other member of my loving cancer team, the surgeon. He was the one who was doing the what we call a laparoscopy. So it's not a gastroendoscopy, though it is. You do get a tube down your mouth. You're getting another one through your belly button too. So you're going to flush my whole peritoneal cavity here with fluid and take out some samples and find out what kind of radical cells or free radicals are roaming around there. And meanwhile, look at outside of the organ, look at inside the organ, pick another biopsy. That's 3 biopsies, very dangerous, very dangerous. Assuring me and patting me on the hand, oh, it's okay, I'm the best there is, I'm a gastric surgeon, that's all I do. That's all I do all day long. Perform surgeries on stomach, on the stomach area, and the upper tract. So, you get into this whole sort of trap. You're getting into the whole, oh, they're the experts. They got to know what they're doing. They're creating this fear about the metastasis. Oh my God, what could happen? But don't worry. This tumor took a really long time to grow, so there's no rush in getting that laparoscopy. Where I now have 2 scars on my belly button and on my stomach area below here. So, it's unbelievable just how quickly you can get wound up into that right away. And then I got freaked out. It's like, oh, I can't perform the laparoscopy for another 2 weeks, 3 weeks. I've got to free up my schedule. I don't know when that'll be. And once that's done, you're going to have chemo, radiation surgery, followed up with more chemo. That's the one route if you don't have metastasis. Oh, the other route could be it's chemo, and that's all you get. Yeah. So go on off to your long weekend, enjoy yourself. We were going off to a cottage that same day. Oh, can I tell you? Oh shit! So that was challenging, and I think that very irresponsible for a doctor or a surgeon to be talking like that when he didn't get the facts, and it looked like to him that he was going to get some negative results. So that was already in his tone of voice. So come 3 weeks later, I finally get the laparoscopy, and I'm freaking out. I'm looking at all sorts of other natural remedies. I'm getting Reiki, I'm getting my acupuncture in line, I'm taking my special tea from the Chinese doctor. I'm starting to take my CBD oil, the cannabis oil, which is very high in CBD, very low in THC. That is a treatment for pain, nausea, any kind of pain like that, associated with bodily trauma. So I was taking lots of natural remedies until that date. Oh, and then I woke up from that laparoscopy. Surprise! You're doing great. I was like surprisingly good. Is basically what my surgeon said as I woke up. That was successful. And the surprise on his face was really the thing that got me. Like, why are we so surprised? And why are you making me feel like, I'm already done for, right? Kind of case. That was stressful enough. And then the pain after a laparoscopy, they're filling you full of fluid and gas to open up the peritoneal wall, off your organs. And I'm going home with this stomach, like out to here. I'm so bloated I can't get out of bed. I can't get down into bed. I was in so much pain. I was taking probably about 2,000 milligrams of Tylenol every day, leading up into the first blood work for chemo. Again, don't forget, they think all the information they're going to get from you is like the blood, not the lymphatic. 25% of your body is blood. 75% is your lymph fluids. So they're getting all this information, drawing blood out of me, and they're like, oh gosh, you have a liver spike. I said, yeah, that's from the Tylenol I took post-laparoscopy. No, can't be that. But you do realize I never take drugs. I don't take medication for anything. I'm a natural eater. I've been vegan for several months, and I've been vegetarian for over 20 years, 24 years. That, I'd never even took, maybe once in a while for a headache. I never took a lot. So, use always tinctures, I use always natural remedies. Tylenol couldn't produce a liver spike. This is the oncology nurse of the hospital telling you that. So the lack of knowledge, the lack of information, the way that they just own you. They own you, and you're like, they got a grab of you, and they're like, yeah, we'll tell you when you can or can't get treatment. And, I should have taken that as a first sign. Don't take the treatment. Boom. Anyway, if I had known back then, all those liver spikes were a sign from the universe, and that was not the way to go. You don't want this kind of stuff in your system. Chemo is, like I said, biohazardous, and I'm saying is so dangerous that you have to go to certain technician professionals who are trained nurses to unhook you from a bag of chemo that is so biohazardous. It's like you're jamming battery acid into your fluid. I mean, what does acid feel like when you can't even touch it? You're not allowed to touch it. If it lands on your skin, you're going to burn your skin. You're going to drill a hole right through your skin with that acid. That's the corrosiveness and the biohazardous nature of this chemo that they're pumping in through your port. It's crazy, and how is that supposed to be good for you? You know, how is that right into your vein? Remember the vein leading to your heart. Yeah, so right into there. Flood, 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 flood. I know this is first time around was just incredibly painful, quite a nausea, so bad. Um, oh, but they give you anti-nausea pills for it too. Oh yeah, they got plenty of drugs to fill you up with. Yeah, anti-nausea. Yeah. What? More anti-nausea. These are PRNs. Feel nausea? Take one. Because once you start the vomiting, you can't stop it, you know. So they make it sound like it's very, very scary. How horrible this drug is. That's pumping into you, and you've got to take more drugs to fight off the side effects. Unbelievable. So you know, it's incredibly painful. It's incredibly traumatic. You're trying to eat afterwards. Forget that. I saw, you know, you're sitting in a cancer ward. You're sitting amongst 12, 15 people in one ward. There are several colorful little wards, you know, by beautiful rainbow colors. In one ward, I was sitting beside a 19-year-old, probably very young, 18, 19, just a sweet young thing, staring blankly off into space. She had her girlfriends around her, maybe a sister, and it was heartbreaking to watch her. You know what she was going through. Her visitors left, and I was there watching a movie while I'm getting my chemo, and watching just to get my mind off of it. But I'm listening to what happened next door, next seat over. She's breaking down, you know, and she's crying and saying, I think that something was not working right with her program or schedule. And she said, you know, what are you giving me here? You're not giving me candy and gum. This is not, you know, this is not fun for me. This is painful. And those are her words. And she was just wailing and screaming and, you know, those oncology nurses, they're not really trained for that kind of responsiveness. They're not really there for you and emotionally helping you through this struggle. Yeah, it broke my heart. It did break my heart. Such a young person having to go through the same thing I was going through in the port. And Jesus, wow. So I could tell you that this is when they felt that they owned me. Yeah, and I think once they don't own you, which is now, they make it very hard. Now my current struggle is getting this port out. Oh yeah, they're trying to really make it difficult. They put it in just like that, lickety split. Now it's like I gotta wait another month. I called my new GP. I got rid of the old one, the crusty old hag who thought she knew everything and got it all wrong, didn't even know about diet, didn't know about acidosis, didn't know about alkalinity base versus acid forming foods, didn't know about what could be causing the problem I'm having, genetic history. My father has had prostate cancer. He's alive today. Of course, with a lot of post-cancer symptoms, heart, blood pressure. My grandmother, who died of lymphoma in the armpits, she was in a lovely little hospital in Haifa, Israel. You know, very progressive little country, and I used to live there myself as a little girl. And you know, she went there. She thought she was going to get the best of care in Haifa, and ended up dying. So history, family history, weakness of cell, genetics, weakness in the birth order. I'm second in line, so the weaker you are means you're further away from being the firstborn. So that genes get weaker and weaker with every child, and family history of weak genetics leading to cancers. poor dieting if you look at my father and my grandmother, really. So if you know the real reasons for cancer, and we don't like, again, it's my anti-cancer journey because I'm changing the terminology. It's what causes bad cells or mutated cells, cells forgetting their genetics, how they're supposed to form. Acidosis, major tumor causing situation there. So you gotta think about all of those things. And I want to continue this discussion with more about chemo, with more about the great things about radiation. Oh, it's so beautiful. How many treatments I went through for that. And I'd like to go through all that with you because it's still fresh in my mind. And again, I'm a dropout from all of this since a week ago. My name is Margarita. I want to share more with you, and I'll talk to you soon. Bye.